Good morning everyone. So today I will be talking on the topic fluoride iontophoresis and mineral metabolism. So coming to the overview of the topic, what is fluoride iontophoresis? So specifically iontophoresis is a process where we use a mild electric current to deliver ions that are charged to transfer into the body, whether it be enamel in our case for the oral cavity or through the skin or any other body tissues. So coming to fluoride iontophoresis, it uses mild electric current to deliver fluoride into the enamel. It is a modern day technology, cutting edge, which is non-invasive in nature for managing early carious lesions and white spot lesions. So it is having a link to enamel mineral metabolism. How? Because we will be having the mineral metabolism between the various ions in the body that will help balance the mineral loss and gain throughout the body. So coming to the enamel mineral metabolism in general, the overview of it. So we already know the hydroxyapatite forms the 96% inorganic matrix in the enamel. It is a key mineral in enamel made of calcium and phosphate. It will be having demineralization process and role of fluoride in the mineral metabolism in throughout this fluoride iontophoresis. So giving an overview. So coming to the demineralization process, acids from the bacteria dissolve the enamel minerals, creating white spot lesions. Coming to the demineralization process, minerals from the saliva and treatments that we offer therapeutically repair the demineralized enamel. And specifically, why fluoride iontophoresis? Because fluoride will replace the hydroxyl ions to form fluorapatite, making the enamel stronger. So coming to the device, and how it is used, this is the graphical image representation of it. So the device uses a direct current power source. It has components, namely active electrode, negative electrode. Active electrode will be different in different cases. In cathode iontophoresis, it is cathode, it is active, and in anode iontophoresis, it is the anode, that is the active electrode. So the active electrode is placed on the node that is to be tested with fluoride gel or solution. Second, the return or the reference electrode, the second part of it, is placed on the opposite side, which will be in contact with the fluid, which will be specifically Ringer's solution in general, which will be applied to the skin or the mucosa for the test. And the DC current flows from the negative terminal through the fluoride solution and then to the tooth surface, and then this electric field that is created makes the fluoride ions to move into the enamel by electrorepulsion process. So this is the graphical representation of it in the skin surface, and also how it happens in the teeth. It is represented in this image. So how exactly the fluoride iontophoresis takes place, what is the principle behind it, what are the polarities that I already discussed, we will look into that. So first, it uses electric current, as I told, direct current to push fluoride ions deeper into the enamel pores. Polarity I already told, in cathode iontophoresis, the CIP repels fluoride into the enamel by electrorepulsion process. AIP, by the electroosmosis process, helps in the movement of the neutral ions. So coming to the advantages of the technique, it is enhancing the fluoride penetration in the body, in the teeth. It is a fast, effective, and no drilling or pain symptoms are there. Mostly the agents used for this fluoride iontophoresis is sodium fluoride. Ringer's solution that will be placed on the negative terminal stimulates internal tooth pressure. Other agents that can be used in fluoride iontophoresis, except of 5% NaF, is stannous fluoride, calcium glycerophosphate, CPP, ACP, sodium monofluorophosphate, amine fluoride, silver diamine fluoride, bioactive glasses, that is novamin, and tricalcium phosphate, zinc ions can also be used, and hydroxyapatite nanoparticles. Specifically, research has been done on silver hydroxyapatite nanoparticles. So coming to the procedure, how this fluoride iontophoresis takes place. So depending upon the samples that we are going to use, specifically the tooth. So first step is the cleaning of the tooth surfaces to remove any debris. Secondly, etching by 35% phosphoric acid for 15 seconds. Then we will rinse the tooth surface with deiodized water or left it to air dry also. Then we will place a small amount of the 5% sodium fluoride solution on the lesion, and then we will connect the electrodes, the active electrode and the return electrode. Active electrode will be placed on the tooth that is needing the treatment. Also, the return electrode is placed on the fluid system or any other system outside the mouth, as I said, skin or any other, for drug delivery. And second, next we will apply a low direct current, usually of 0.5 milliampere for 30 to 40 seconds, and also maintain contact under stimulated pulpal pressure. The upper limit for the pulpal pressure in natural tooth is 15 mmHg. So if we are testing any tooth for in vitro studies, the upper limit will be maintained. Also, we will remove the electrodes and then rinse off the residual fluoride and try and observe these changes for post-treatment changes, and we can give it for imaging. So coming to the evaluation methods, how the fluoride iontophoresis that we have done in vitro can be evaluated. So first comes the micro-CT. We can evaluate using micro-CT. It specifically measures the mineral density. Secondly, we can use the SEM and the EDS for showing the surface changes in the structure and the elemental composition of the enamel. Thirdly, the advanced procedure is XAS. It will be having two components. The XANES, which will analyze the first one will analyze the oscillations beyond the absorption edge to provide details about the distance and the number of neighboring atoms that being displaced by the fluoride iontophoresis. And the second one, EXAFS, it will analyze the oscillations beyond the absorption edge limit, and also it will provide the distance and the number of the neighboring atoms, specifically the calcium and the phosphorus in the enamel. So coming to the recent research insights, based on this only I have formulated today's journal club. So it was published in Journal of Dental Research in 2022 December, in which it is an overview of the research. The CIP, the cathode iontophoresis, showed 85% increase in mineral density when we use the teeth in vitro and crystal improvement. FA and FSJ, fluoroapatite and fluorohydroxyapatite formation also is increased, and it is confirmed by the XAS process, specifically in the cathode iontophoresis treated teeth. AIP showed mild improvement with no crystal change, that was the control, and tropical fluoride showed no on the subsurface effect, that is 0%. So coming to the clinical relevance, why it is required and what is the future scope in iontophoresis, specifically fluoride iontophoresis. So it is useful for reversing early decay in children and high risk adults, specifically to prevent the early childhood caries and the treatment of white spot lesions. But we have to do more studies on the safety, doses, applied electric current and the long-term effects of it. And it has potential for home or chairside iontophoresis devices, that if this in vitro study is translated clinically, we can develop devices on our own to have the iontophoretic devices which will be used for testing of early and white spot lesions.